My name is Caroline Reidy. I'm a third-year medical student at University of Tennessee, and my poster today is about the use of MMP-9 as a biomarker for dry eye disease. So the purpose of this study is, like stated below, so dry eye disease is a very common condition resulting from tear film disruption and ocular surface inflammation. Matrix metalloprotein 9, hereby referred to as MMP-9, is an inflammatory mediator found in tears that's associated with dry eye disease. This study investigated the relationship between a point-of-care MMP-9 test and the severity of dry eye disease as measured by its signs and symptoms to determine if MMP-9 could be a viable biomarker for dry eye disease diagnosis. And a little bit more on that is dry eye disease, while it's very common, there is no clear definitive diagnosis for it right now. It's very relative to the physicians assessing it and to subjective symptoms as reported by the patients. So we're hoping to find something that's a little more objective, and that's what MMP-9 was investigated for in this case. This figure down here on the bottom left is just kind of an explanation of how MMP-9 is involved in this cycle. So stress, be that oxidative stress, hyperosmolarity, or tear film disruption, then leads to epithelial cell dysfunction, which sets off some MAPK and NFK beta signaling activation that results in inflammatory mediator production, including TNF alpha, IL-6, IL-1 beta, and interferon gamma, all of which feeds into MMP-9 production, which causes further ocular surface inflammation, epithelial cell loss, and decreased mucin production. And all of that becomes a vicious cycle of increased inflammation feeding into itself. So the methods for this study: participants in the dry eye assessment and management DREAM study, which was a much larger study overall investigating a lot of different aspects of dry eye disease, received MMP-9 point-of-care testing at a screening visit and at 3 months. The associations between MMP-9 results and several measures, including keratography testing, which included non-invasive keratography, tear breakup time, tear meniscus height, and bulbar redness, clinical examinations, including tear breakup time, the Schirmer test, meibomian gland secretions and plugging, tear osmolarity, conjunctival staining, and corneal staining, as well as the Ocular Surface Disease Index questionnaire, were all analyzed. The results of this study showed that among the 211 subjects, among which there were 422 eyes analyzed, the mean age was 57.7 plus or minus 13.3 years, and 79% of subjects were female. Our preliminary analyses showed that a significantly higher percentage of male subjects than female subjects were MMP-9 positive, 70 versus 51% with a p-value of 0.01. Postmenopausal status and tear interferon gamma levels were also associated with MMP-9 positivity at baseline. No other cytokines that we investigated or HLA-DR gene positivity at baseline were significantly associated with MMP-9 status. Further, there were no significant associations found between MMP-9 and dry eye disease measures at baseline or at 3 months follow-ups. And there was no significant relationship between change in MMP-9 status and the change in signs and symptoms. And so that's kind of all summarized in this table below, which just shows the 3 significant findings, which were sex, postmenopausal status, and tear interferon gamma levels, because there were a lot of negative results, including a lot of things that we suspected would be positive, like HLA-DR and other cytokines that have been shown to be pretty related with dry eye disease pathology. So in conclusion, in the DREAM study, a significant relationship was found between baseline MMP-9 positivity and sex, postmenopausal status, and tear interferon gamma levels. MMP-9 point-of-care testing status was not associated with dry eye disease severity as measured by signs and symptoms. And so as of now, this MMP-9 point-of-care test does not appear to be a viable biomarker for dry eye disease. Okay, any questions?
All right. So what's your hypothesis for why male patients were more likely to be MMP-9 positive?
That one is interesting because a lot of research had shown that being a premenopausal female is protective against that. Estrogen is a protective factor in these inflammatory pathways. So it wasn't shocking to see that postmenopausal women had a much higher level. The male aspect, though, was surprising. That doesn't really go with most of the research that has been shown, other than the confound of pre versus postmenopausal status. And I think further studies are definitely merited there. It was also an interesting finding because dry eye disease is much more prevalent among women.